Welcome to our new presentation. Our selected topic for today is blood pressure measurement. In this video, we will answer the most important question of how to measure your blood pressure manually. In our previous videos, we have discussed about normal blood pressure, systolic blood pressure and diastolic blood pressure. How does your blood pressure change with aging? How often should you get your cholesterol checked? How to get your cholesterol tested? What should your blood pressure is according to age? How to lower blood pressure without medicine? What is hypertension and classification of hypertension, and what are the causes and symptoms of high blood pressure? The links of all those videos are on the description. You can watch those. Welcome once again to our nursing exercise channel. If this is your first time here, we have a YouTube channel that aims to enrich your knowledge about your health, fitness, medication, nutrition, diet, etc. And if it is your plan to update yourself about these important issues for all of the important tips, advice, discussion and presentation, make sure to subscribe to our channel and click on our notification bell icon. Let's start our presentation. How to measure your blood pressure manually or in a seated position. Vital sign measurement and assessment are important components of the review of systems in a physical examination for individuals with and without documented cardiopulmonary disease. Accurate measurement of blood pressure is critical for making appropriate clinical decisions, especially if physicians wish to play an important role for management of hypertension. This video will provide an updated American Heart Association scientific statement on BP measurement in humans in a seated position. Step 1. Properly prepare the patient. It includes the followings. 1. Have the patient relax, sitting in a chair with feet flat on floor and back supported. The patient should be seated for 3 to 5 minutes without talking or moving around before recording the first BP reading. A shorter wait period is used for some AOBP devices. 2. The patient should avoid caffeine, exercise, and smoking for at least 30 minutes before measurement. 3. Ensure that the patient has emptied his/her bladder. 4. Neither the patient nor the observer should talk during the rest period or during the measurement. 5. Remove clothing covering the location of cuff placement. 6. Measurements made while the patient is sitting on an examining table do not fulfill these criteria. Step 2. Use proper technique for BP measurements. It includes the followings. 1. Use an upper arm cuff BP measurement device that has been validated, and ensure that the device is calibrated periodically. 2. Support the patient's arm, e.g. resting on a desk. The patient should not be holding his/her arm because isometric exercise will affect the BP levels. 3. Position the middle of the cuff on the patient's upper arm at the level of the right atrium, midpoint of the sternum. 4. Use the correct cuff size such that the bladder encircles 80% to 100% of the arm. 5. Use either the stethoscope diaphragm or bell for auscultatory readings. Step 3. Take the proper measurements needed for diagnosis and treatment of elevated BP, hypertension. It includes the followings. 1. At the first visit, record BP in both arms. Use the arm that gives the higher reading for subsequent readings. 2. Separate repeated measurements by 1 to 2 minutes. 3. For auscultatory determinations, use a palpated estimate of radial pulse obliteration pressure to estimate SBP. Inflate the cuff 20 to 30 mm of mercury above this level for an auscultatory determination of the BP level. 4. For auscultatory readings, deflate the cuff pressure 2 mm of mercury, and listen for correct cough sounds. Step 4. Properly document accurate BP readings. It includes the followings. 1. Record SBEP and DBP. If using the auscultatory technique, record SBP and DBP as the onset of the first of at least 2 consecutive beats and the last audible sound, respectively. 2. Record SBP and DBP to the nearest even number. 3. Note the time that the most recent BP medication was taken before measurements. Step 5. Average the readings. Use an average of is greater than or equal to 2 readings obtained on is greater than or equal to 2 occasions to estimate the individual's blood pressure. Step 6. Provide BP readings to patient. Provide patients their SBP, DBP readings both verbally and in writing. Someone should help the patient interpret the results. If you have any query, please comment in the comment box, and if you enjoy watching our videos, please subscribe our channel to receive notifications every time we upload a new video. Hit the bell icon twice. Thanks for watching.